Hello everyone, it's me, nurse practitioner Dr. Katina. I'm here with a great topic today, endometriosis. I've received numerous inboxes regarding endometriosis. Well, here's some information. Remember, the information that I include here is not limited to this information, but I wanted to just give you some brief information on endometriosis. This is a very, very painful condition that many women suffer from. So what is endometriosis? Endometriosis occurs when tissue that should line the inside of the uterus and the endometrium, but it grows outside of the uterus instead. And it may grow in the ovaries or around the ovaries or the fallopian tubes. But this causes those areas to become swollen and inflamed, and scar tissue and lesions, they develop. What causes it? Unfortunately, the researchers don't know. It's not much information out there. They really don't know the cause, but they do say genetics play a role. Family history, if your mother or your sisters developed it, a lot of times you will as well. What are some symptoms? If you suffer from endometriosis, well, you know the symptoms. Ladies, this is not just your regular cramps that you get during your cycle or your menstrual period. These are severe, painful cramps. They have you rolled over in pain in the bed. You can't move. A lot of times you have painful sex, abnormal, heavy bleeding as well. Patients complain of low back pain during the menstrual cycle, and sometimes some women have difficulty getting pregnant as well. How do we diagnose this? Through an ultrasound. We also do a hysteroscopy, which is when we go inside of the uterus to take a look inside. Also with the microscope. Also, an MRI can be used to diagnose this. What can you do about it? There are a couple things that we do, okay? If you're all for natural medicine, you know, you can work on your diet, you know, watch certain foods that you eat that can cause inflammation in the body, so that may help. But as far as some conventional medicines, you have your NSAIDs that some women use during their cycle to help with this, such as your ibuprofen, your Motrin, your Advil, your Aleve. Some women may use Danazol, which is prescribed, which is an estrogen antagonist. That helps just decrease the bleeding and the inflammation. Also, progesterone-only pills, that may help as well manage endometriosis. As far as your surgery options, I don't know if you all have heard of a Novasure, or also known as an endometrium ablation. Basically, that's where a laser kind of burns off that area, and that helps get rid of a lot of the lesions and the tissue that may be causing that inflammation. So endometrial ablations, they may do laparoscopic, where they go in and remove the lesions and the scar tissue. And then last but not least, a hysterectomy may be an option for you as well. So again, there is hope out there for you. There are some options. If you are looking for natural remedies, again, it starts with your diet. You want to ingest foods that are low in estrogen, and you want to make sure you eat healthy, you exercise. The research does show that persons who exercise and drink warm fluids during this time as well, that really helps them as well. All right, so again, this is just a brief video on endometriosis. I hope that this information that I portrayed here for you will help you. And if you do suffer from very severe, painful, heavy periods, crampy periods, go get help. See your gynecologist so that they can give you your options. All right, until next time.